Hi guys, today we'll talk about another supplement called lithium. One of my patients asked me about over-the-counter use of lithium orotate. Few things you must know about lithium. We commonly use lithium carbonate in our psychiatric patients for bipolar disorder. And the over-the-counter available lithium is mostly lithium orotate or lithium with orotic acid. That combination is usually available over the counter. There are some claims about the lithium used in kiddos with autism spectrum that it can improve their aggression, their irritability, restlessness, and sometimes it calms down, improve their sleep also, and helps them in the focusing. But few things very important about lithium, and you must know about lithium, is even a low dose of lithium can accumulate in your kidneys, in the thyroid, and can cause tremor, confusion, problem with your kidney function, problem with your thyroid functions. So whenever we prescribe lithium carbonate for bipolar patients, we always closely monitor their lithium level because it's a very low therapeutic index, a very low window, and even a smaller higher dose can cause problems. So whenever patients ask me the use of lithium in their kiddos with autism spectrum, I always tell them, always discuss with your doctors first, always sit down and know what are you trying to achieve and what are the benefits, and you must know what are the side effects of lithium and sometimes lithium interactions with other supplements. The thing is, there are many over the counters, different preparation with different concentrations of lithium are available. So whenever you think that you want to start lithium, read and always check the concentration what you are using. I have seen sometimes end up using different concentrations because you are buying from a different pharmacy or different online stores. So make sure, especially with lithium, it is very important that you must know what concentration, what are the side effects, and how to monitor, and what are the side effects if it accumulates in different parts of the bodies, as I mentioned earlier, like in thyroid or in your kidneys. So please discuss before starting any medication, and always tell your physician that these are the other supplements, other herbal, non-herbal, other prescription medication your child is taking, and always check the interaction, especially with lithium. It is very important. Please feel free to ask any question. Thanks. Have a good day.